Today we're going to talk about stroke, a serious medical condition that affects millions of people worldwide. Let's dive in and learn about its causes, types, and risk factors. Stroke is a sudden neurological problem caused by damage to the brain's blood supply. It's the second leading cause of death and disability globally. But what exactly happens during a stroke? There are two main types of stroke: ischemic and hemorrhagic. About 85% of strokes are ischemic, which means a blood clot blocks blood flow to part of the brain. The remaining 15% are hemorrhagic, where a blood vessel in the brain bursts. The important thing is that aspirin should not be taken or given unless under medical advice, as the suspected stroke could be a hemorrhagic stroke. Now, let's talk about risk factors. Some we can't change, like age, sex, and ethnicity. As we get older, our stroke risk doubles every decade after 55. Men and women have different risks at different ages. And some ethnic groups, like African Caribbean individuals, have a higher stroke risk. But there's good news. Many risk factors are things we can control. The big one is high blood pressure. It's the most important modifiable risk factor for stroke. About half of all stroke patients have a history of high blood pressure. Other risk factors include diabetes, which doubles your stroke risk, and heart problems like atrial fibrillation. Smoking is another big factor, doubling your risk too. But stopping smoking can quickly lower that risk. What about lifestyle factors? Drinking too much alcohol, being overweight, and not exercising enough can all increase your stroke risk. But staying active and maintaining a healthy weight can help protect you. Let's get into the details of how strokes happen. For ischemic strokes, there are three main culprits. 1. Small vessel disease. This affects tiny blood vessels in the brain and causes about 25% of ischemic strokes. 2. Cardioembolic stroke. This is when a blood clot forms in the heart and travels to the brain. It causes about 25% of ischemic strokes, often due to a heart rhythm problem called atrial fibrillation. Wait, there is more, but do not forget to hit the like button and subscribe, down below. 3. Large artery disease. This is when the big arteries supplying the brain get clogged up, causing about 20% of ischemic strokes. For hemorrhagic strokes, the most common cause is a condition called cerebral small vessel disease. This can weaken blood vessel walls, making them more likely to burst. Now, you might be thinking about strokes in younger people. They do happen, accounting for about 10 to 15% of all strokes. The causes can be different in this age group, including things like blood vessel tears, called dissections, heart problems, and sometimes recreational drug use. Here's an interesting detail. In about 20 to 30% of ischemic strokes, doctors can't find a clear cause. These are called cryptogenic strokes. They're a bit of a mystery, but researchers are working hard to understand them better. Let's talk about how doctors diagnose and classify strokes. They used to rely solely on symptoms and timing. But nowadays, brain imaging plays a big role. MRI scans can show even tiny areas of brain damage, helping doctors make more accurate diagnoses. Understanding the cause of a stroke is super important. It helps doctors choose the best treatment and prevention strategies for each patient. Speaking of prevention, let's talk about what we can do to lower our stroke risk. Controlling blood pressure is key. If you have high blood pressure, work with your doctor to get it under control. If you have diabetes, managing your blood sugar levels is crucial. For those with atrial fibrillation, blood-thinning medications can greatly reduce stroke risk. Quitting smoking, limiting alcohol intake, eating a healthy diet, and staying physically active are all great ways to lower your stroke risk. And if you're overweight, losing some weight can help too. It's also important to be aware of stroke symptoms. The faster someone gets treatment, the better their chances of recovery. Common symptoms include sudden weakness or numbness on one side of the body, trouble speaking or understanding speech, and sudden vision problems. Stroke is a complex condition with many possible causes. But understanding the risk factors and taking steps to address them can make a big difference. Remember, Many strokes are preventable with the right lifestyle choices and medical care. Hey there! Today we're talking about something really important: what to do if you think someone's having a stroke. It's scary, but knowing what to do can make a huge difference. So let's dive in. First things first, if you suspect a stroke, call 911 or your local emergency number right away. Time is crucial here. Every minute counts when it comes to stroke treatment. In fact, doctors have a saying, time is brain. The faster someone gets help, the better their chances of recovery. But while you're waiting for the ambulance, there are some things you can do to help. Let's go through them step by step. Step 1. Use the FAST method to check for stroke symptoms. FAST stands for face, arms, speech, and time. Here's how it works. Face. Ask the person to smile. Does one side of their face droop? Arms. Ask them to raise both arms. Does one arm drift downward? Speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? Time. If you see any of these signs, it's time to call 911 immediately. Remember, even if the symptoms seem mild or go away quickly, it's still important to get medical help. It could be a mini stroke, which is a warning sign of a bigger stroke to come. Step 2. While you're waiting for help to arrive, try to keep the person calm and comfortable. Help them lie down on their side with their head slightly raised and supported. This position can help if they feel sick or need to vomit. Step 3. Check if they're breathing. If they're not breathing, you might need to start CPR. But only do this if you're trained. If you're not trained in CPR, the American Heart Association recommends doing chest compressions only. Push hard and fast in the center of the chest, about 100 to 120 compressions per minute. Step 4. Loosen any tight clothing around their neck. This can help them breathe more easily. Step 5. If the person is conscious, try to keep them calm. Talk to them in a reassuring way. Let them know help is on the way. Step 6. Don't give them anything to eat or drink. When someone's having a stroke, they might have trouble swallowing. Giving them food or water could cause choking. Step 7. Keep track of when the symptoms started. This information can be really helpful for the doctors. Step 8. If possible, gather information about the person's medical history. Do they have any health conditions? Are they taking any medications? This info can be super helpful for the emergency responders. Now, let's talk about what not to do. Don't try to drive the person to the hospital yourself. Ambulances are equipped to start treatment right away and can get to the hospital faster. Also, don't give them any medication, not even aspirin. Some strokes are caused by bleeding in the brain, and aspirin could make that worse. It's important to know that strokes can affect people differently. The symptoms we talked about with FAST are the most common, but there are others to watch out for too. These include sudden numbness or weakness, especially on one side of the body, confusion or trouble understanding speech, trouble seeing in one or both eyes, difficulty walking, dizziness or loss of balance, severe headache with no known cause. Now, you might be wondering, how common are strokes? Well, they're more common than you might think. In the United States, someone has a stroke every 40 seconds. That's about 795,000 people each year. But here's some good news. Knowing the signs of a stroke and acting fast can make a big difference. Studies have shown that patients who arrive at the hospital within 3 hours of their first symptoms often have less disability 3 months after a stroke than those who received delayed care. Let's talk numbers for a second. When it comes to emergency response times for stroke, a study found that the median total time from when someone calls 911 to when they arrive at the hospital is about 36 minutes. But this can vary depending on factors like age, race, and whether you live in an urban or rural area. Now, you might be thinking, 36 minutes doesn't sound too bad. But when it comes to stroke, every minute counts. For every minute a stroke goes untreated, the average patient loses 1.9 million neurons. That's why it's so important to recognize the signs and call for help right away. But here's something interesting. The same study found that only 78% of emergency responses met the guideline of less than 1 minute for dispatch delay. And only 72% met the guideline of less than 8 minutes for time to arrive at the scene. This shows there's still room for improvement in emergency response times. So, what can we do to help? Well, knowing the signs of a stroke and how to respond is a great start. But we can also spread the word. Tell your friends and family about the FAST method. The more people who know about it, the better. And here's a tip. If you're calling 911 for a suspected stroke, make sure to use the word stroke when you're describing the situation. This can help ensure the right resources are sent and that the hospital is notified in advance. Now, let's talk about recovery. Every stroke is different, and recovery can vary a lot from person to person. But getting treatment quickly can make a big difference. It can help limit brain damage and improve the chances of a good recovery. After a stroke, most people will need some form of rehabilitation. This might include physical therapy to help with movement, speech therapy, or occupational therapy to help with daily tasks. The goal is to help the person become as independent as possible. Recovery can take time, and it's often a team effort. Doctors, nurses, therapists, and family members all play important roles. But the stroke survivor's attitude and effort are crucial too. Many people make significant improvements in the weeks and months after a stroke. So, let's recap what to do if you suspect someone's having a stroke. 1. Use the FAST method to check for symptoms. 2. Call 911 immediately if you spot any signs of stroke. 3. Help the person lie down comfortably. 4. Check their breathing and perform CPR if necessary and if you're trained. 5. Loosen any tight clothing. 6. Keep them calm and reassured. 7. Don't give them anything to eat or drink. 8. Note when the symptoms started. 9. Gather information about their medical history if possible. Remember, your quick action could save a life or prevent serious disability. Strokes are scary, but knowing what to do can make a real difference. Do not forget to click the like button and subscribe. That's all for today. I hope you found this information helpful and interesting. Stay healthy, and thanks for tuning in. Disclaimer: consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice.